Hi,
Hi,
Dr.
hi Anna, how was the day?
A little bit occupied. I was running around all day long, but I'm fine.
Yeah, I think you were with lots of occupations.
I wish I could say that. It's just my kids and their sports activities.
Okay.
And
Well,
trafficking here is crazy.
it's a
Yeah.
different routine when they must go somewhere else, right?
Yes.
Sending them on
Yes.
time, running with everything because, well, usually they forget some details.
Ah, of course they do. Of course they do. And they're like, Mom, Mom, I forgot my
Can you
sweater.
help me
Mom, I
with
forgot
this?
my water. Ay, mocoso.
Yes, I forget it. Can you look for this for me? I
Yes.
cannot find, my son always tell me, I cannot find my shoes, for example.
It's kind of crazy, right?
Yes. But when they get teenagers, it's no way to go back on time, right?
That's what I've been reading. I don't know, maybe those are signs from the universe that I need to enjoy this part of their childhood because it's not coming back.
Yes, but
So
certainly
let's
it's a
try.
relief. Uh, Sometimes it's a relief when they grow up.
Yeah.
And then you say, I can take a breath now. I hope it might be easier, but no, it's not easier.
Like the urban legend says, the bigger the kid, the bigger the problems. So
Yes, that's the truth.
I know.
Yes. When they ask for independence, everything changes. And you say,
Oh
why? I want my babies back.
Please go back to your crib.
Yes. I said that when my kid actually is 11,
Uh-huh.
but he has ADHD. He's with this condition.
Mm-hmm.
And actually his thoughts are from a boy of 15. So
Oh,
now he is a teenager. His mental development is different from the rest of the kids of his age.
of course.
So now I have a teenager at this moment, so it's not easy to
Hey.
talk to him because well you can see how he acts, the reactions, how everything is changing about likes and dislikes, of course.
Oh my God.
Say, where is my kid? He's still looking like a small boy, but
But
now he's a teenager now.
oh, yeah. His
And
attitude.
yes, he said it is so difficult,
Oh my
but
God.
patience.
Patience and enjoy the ride while it lasts.
Yes, yes, I said, let me take a breath. No, why? He tells me, why you do this to me, mom? And I said, well, patience.
Oh no.
Well, can you watch my screen?
Yes, I can. Let me see.
Perfect.
Yes.
Is that
Oh,
possible to read this handwriting?
I prostate grade 3
Yes.
enlargement with significant
Medium,
median
low
median low
enlargement.
enlargement.
Yes.
PR approximately 60 mLs. Right
Yes, 60
kidney,
months.
right kidney is normal. Inside shape,
Yeah.
eclos. I don't know shape. I don't know what eclo something. Eclus tube.
In gesture, I don't know. Well, shape
That kid.
echo.
Ah, that's the ultrasound from the case, right?
Yes, yes. I'm trying to remind this word. Echo. Well, doesn't matter. At this point, it's not important, but because you're not going to develop to the patient this expression.
Yes.
But
He had un pólipo benigno, right?
yes, a benign polyp.
Benign polyp and grade 3 enlargement of prostate. Wet light renal
With
cyst
right renal
with
cyst.
with light renal cyst would be cystitis, right? Kind of thing.
No. This is a kyste.
Ah, quiste, perdón. Yeah, okay.
Yes. How
Quiste.
could you explain this information to Mr. Jones? Imagine this is the ultrasound of Mr. Jones.
Oh, the
He
one that we
comes to you and he tells you, dear Anna, I'm really upset because I don't understand anything. The doctor just gave me this report and I don't understand. Can you explain it to me, please?
Oh, yes. Thank you for
Now
the heavy work. I'm doing the dirty work for the doctor.
yes.
Well, Mr. Jones, first of all, relax, take it easy. We're gonna go through your ultrasound opinion step by step. I'm gonna try to make it as easier as possible for you. And if you have any doubts, you just
Oh, I'm
now
sorry.
I lost the ultrasound.
I'm sorry. By my fault, I pushed the wrong
Exit.
button.
You're like, okay, we're done.
I said, stop sharing. Okay. Is that okay? Do you
Just
need
one
it?
quick question. Is a prostate grade 3, is it like in a
Actually,
scale of 1 to 4?
yes, we have 4 scales, 4
Okay.
grades. The third and the fourth are for surgical solutions.
Okay, that's
The
what
treatment
I.
is not possible.
Okay.
You receive
Treatment.
treatment for around 3 to 6 months according to the situation.
Okay. But in
For
this case, he needs surgery, right?
yes,
Because he even has
the final
cyst.
solution is the surgery process.
Mhm.
But he needs to prepare his body taking pills.
Okay.
We can say for making solid the tumor and getting it easier to take out.
Because it is soft. It is
Okay.
like sex, like
It's
it
like
has
a
liquid.
jelly. No, not
Jelly.
liquid. It's like a
Jelly?
jelly. Well, no, not jelly. Even though it's harder than a jelly, it's not
Okay.
so hard as it must be for the surgical procedure.
Oh, okay. Okay.
At this point, it's very easy to place the I forgot the name. What's wrong with me today?
You're kind of tired, I think. Like me.
Yes.
I was yawning all the way here and I was like, what the hell is going on with me? We're moms.
Yes, the bladder, the
Sorry.
sonda. Yeah, I forgot it.
Okay.
Okay, give me an explanation.
Okay.
Is that you need it bigger?
Huh?
Is that okay? Can you read it
Oh,
properly?
yes. Well, let's start with the beginning. You've been diagnosed with prostate enlargement grade 3, which means that in a scale 1 to 4, you are on the third place on the scale to determine whether we could treat you with just medicines or we will have to treat you with surgical intervention. In this case, this means that we found a significant sized polyp that you have, and it is necessary for us to take it out by surgery. It is approximately 60 milliliters, the size. Your right kidney is normal and is functioning well. It has the normal shape of the kidney. Your left kidney, it also is normal on its normal basal limits or standards, but we found that you have a light cyst. So we might be needing some extra procedure besides the prostate enlargement to see if the cyst can be removed surgically. And don't worry about the procedure. The urologist, the surgeon is gonna take it. And also the last thing is that we found a polar just read it, a polar cyst, a polyp. Sorry, the handwritten things from the doctor are kind of confusing. The benign polyp is a little mass that you have, and we've taken a little piece of it, and we've done a biopsy. And for the shape, it seems like it is a benign polyp. So don't worry about it. It's just fine. Sometimes the body decides to make an extra piece of mass around us, but just don't worry, it's fine. It has no morphological signs of being bad. The only thing that now you have to remember is that your prostate is enlarged, but it's not a bad news. Like you have a solution, which would mean surgical intervention, and also that you have a light renal cyst that we're going to figure it out whether it's better to treat it with remedies or with surgery also. Do you have any question?
Yes, is that cancer? That's the question. Always patients ask about it, no matter if you say something different.
I think we need to proceed with the surgery first so that we can take away the tumor or the prostate enlargement, and then we have to run a biopsy on it. But comparing with your labs, there were no signs for you to worry about, because when you have cancer, you have some values on your labs that are out of range. Specifically for the prostate, I think is the PSA. And I think, if I don't remember wrong, that you were on the normal range. So don't worry, it's not, I don't think it is cancer.
Okay, you give me a new breath. Okay. That's okay, that's great. But
Okay.
while reading this,
Mm-hmm.
he says right kidney is normal in situ, in size and shape. Ecotexture and ecotexture. It means the color of the kidney during the ultrasound is normal.
Okay.
Left kidney.
That was the word.
Yes. Left kidney is normal, but I don't understand this.
Neither do
it's
I.
a low, I don't know what it means. Polar cyst. In the left kidney is the cyst, not in the right.
Oh, so this is wrong.
Yes, the conclusion is mixed.
Oh, that's why I was getting confused. I was like, what? I read before left, but now it says right.
He says right, everything normal, but left, he's describing the cyst.
Oh, so we should have like the images, right? To see.
There was the picture with the image, but it's not so clear.
And I have no idea what are those. Okay.
Yes, at this point, it's not.
It's not. And sometimes it happens. And what do you say? Well, I suppose that when this happens, you need to go to the doctor and ask, was it the right or was it the left kidney? Right?
No, when it happens, it's better to trust on this part. On the description.
That one, okay.
It happens on the conclusion, it could happen. But it's better to go and ensure what's wrong with this information. But usually when they describe the position, well, in the body of the explanation is the correct expression. In the conclusion, it's very common to find this mistake.
Okay. It's very common. Okay. I didn't know that.
But until this point, well, the explanation is very good. So
thank you. I pass.
Yes.
Raspando. I said I have cancer, and I was like, no.
No, at this point we need a biopsy.
Yes.
But the biopsy is, of course, after the surgical procedure. So that's great. That's a good way of giving that explanation. That's the solution that patients are going to look for you to translate this.
Hopefully, that would be great.
Yes, it's very nice. So keep on working. It's a good exercise.
Yes, that would be nice.
Yes, while finishing the workshop, I'm going to send you the file with the labs and the ultrasound. The labs for you, of course, are going to be with the results, and you give me the report by typing, okay?
Okay.
And next week, we can work on the letter of referral, the explanation of this in your case.
Okay, you're going to send the file, and I have to work on it, right?
Yes.
Okay.
according to that, well, it's very easy to make, similar to the explanation you were giving me now.
Okay.
Don't worry about it.
I don't. Oh no.
Yes, that was a very
If I
good
have any
explanation.
doubts, I'll solve them with you on Tuesday.
Yeah, or you can send me a message for preparing your
Okay.
file.
Okay.
According to
Okay,
the
that would be
messages,
good.
we can get clear on some terms.
Mhm.
And well, I think that's all.
Okay.
At this
Okay,
point,
doctor. Thank you
there
so
are no
much.
questions, right?
No, I have no questions. I've been going through the slides and those are quite nice. So no, I have no questions.
Perfect. So my
Thank
dear, while finishing the workshop, so I'm gonna send the file of homework of this week.
Okay, see,
Right?
there's no
And
problem.
then
There's no problem. No rush. Thank you so
perfect.
much. Enjoy
I'm
and
gonna
see you
ask for
Monday,
that
right?
explanations. Yes, see you Monday. Have a
Okay.
great weekend and enjoy your
The
kids. They are
same.
small at this point.
Yes, they are. Thank you. Bye.
Bye. Have a great weekend.
Same. Bye.
Bye.
Bye,
Hi,
Gilda.
Gilda.
Bye.
Gilda. Hi, Gilda. How are you?
Hi, teacher. I'm fine, thank you. And you?
Well, with lots of things to do, lots of job, but
Oh
we are
my God.
here. We are still alive.
Oh,
Okay. Let me organize a little bit the information.
okay.
And give me a second, please. Well, as I was telling you, I'm going to show you an ultrasound and a lab report, okay?
Okay.
Let me share the screen and you are going to read the ultrasound first, okay?
Okay.
Can you watch my screen?
Yes.
Okay, give me an explanation about it. If I show you just this information, can you give me detail or do you need more information about it?
More information, teacher, please.
Okay, it's a prostate ultrasound.
Yeah.
And you have the mass. Do you remember we had a mass in the middle lobe while developing the digital rectal exam?
Yeah.
This is the mass. Try to describe all the structures you can identify from this study.
I think is the urethra. It's okay.
The urethra? No,
Yeah.
no. At this point, it's possible to check the urethra.
Is I think
This black,
prostate.
this black structure, black image.
I don't know, teacher.
It's the bladder.
Okay. Yeah.
Bladder, and it's
Yeah.
full of pee. Okay.
Okay.
So you can see the bladder walls on this part up and on the sides. And in the middle, following the arrow, the big structure is the prostate.
Yeah.
Until this point, right? And the mass we are evaluating is this one. You see the difference in color, right?
Yeah.
Let me get it bigger. You see the difference. It's very not so clear, we can say, but it's darker, a little bit more dark, we can say, than this part, okay?
Okay.
This is the tumor, the mass, but the important part we have to check is the one that is in this second picture, the vertical and the transverse. And here we have some details. We have the volume of this, right?
Yes.
Do you remember this value? When we talk about, let me share again for changing the screens without stopping at any moment, okay?
Okay.
Okay, can you watch it now?
Yes.
Okay, when we have values like this, we get the vertical and the transverse evaluation measurement, and we get a volume. According to the volume, we know we can infer what size, how big is the problem, we can say. How big is the mass, and we can get into the classification. Okay, and
Yes.
following this, we have an example of this ultrasound opinion. I found it by internet. It's amazing, yes. Can you read this to me? I mean, read it. Well, I think the handwriting is not so clear,
Yeah.
but that's the
Yeah.
most complete I could find. Read it and try to explain it to me as if I were the patient. Imagine that I'm Mr. Jones and I'm going to you.
Yeah.
And I tell you, Dr. Gilda, I went to your colleague who gave me this ultrasound report, and I really don't understand. Can you explain it to me, please?
Well, you have the your prostate is a little oh my
Don't
god.
worry, don't worry.
I
Take
don't
a
know
breath. Do
how
you
to
want to take a
explain.
minute for doing this?
Yes, please.
Okay,
Please.
read it. If you want, you can get on mute, or you get close your microphone for organizing ideas. That's okay for me. And as soon as you finish, you call me, okay? I'm here. Okay, go ahead. Okay, is that okay now? Okay. Tell me, give me the explanation, please. I'm upset, doctor. I think it's cancer.
Oh,
Your
okay.
colleague didn't want to tell me anything about it.
Okay. Your prostate is larger than normal, and it is called hyperplasia of prostate, and it is classified by degrees. And yours is the 3 grade, and this causes the problem that you have when you when you uh, go to the bedroom, and the mass is the mass causes an obstruction, and for the reason you have the problems that you have.
So this is the cause of all my symptoms.
Yeah.
Which might be the treatment? I'm scared about it.
You need a surgery.
A surgery? Oh my God. Are you sure about it? Who's gonna treat me? Are you the surgeon?
No.
Uh-oh. Yeah. Oh yeah. So what should we do in this case? Can we start with any pill, any treatment, something extra to do? I don't know. Please, I'm so scared.
You need a evaluation by urologist.
Oh, okay. So the urologist is gonna treat me now, not you?
Yeah, because it's maybe I can give you some treatment, but it's only for a short time. The treatment need to be the treatment is need opinion, specialist opinion.
Okay, I understand now.
Yeah, I can treat only the symptoms, but the cause is the obstruction, and you need to be evaluated for this.
Okay, thank you so much, Dr. Gilda. Okay, that's okay. Okay, dear. We are going to work on this kind of explanations just for practicing, okay? Because it's important to know how to give this information, right?
Yeah.
And while doing this, it's not easy because we can get a surprise.
Yeah.
But on the other hand, this weekend, of course, we have homework, right?
Yeah.
During the homework, we have 2 files. The file for studying the slides. Well, they are prepared, but I'm gonna send it at the end of the workshop tonight. And I'm gonna send a second file when you're going to give me the readings of the labs of Mr. Jones and write down the explanation about this situation, an easy one, a short one, okay?
Okay.
And give me the treatment that you consider necessary. On Tuesday, we are going to work on the letter of referral, okay?
Okay, teacher.
For using or for working, just for taking a view, I'm going to send you the letter of referral guidelines. Just for having the idea, not for writing down. Don't write anything.
Okay.
Just check this and it's gonna be easier to work on Tuesday, okay?
Okay. Thank you.
Oh, okay, perfect. So dear, see you Monday, okay?
Okay, teacher. Bye.
Bye, have a great weekend. Hi, Maria.
Hi, teacher. Good night.
Good night. Well, are you ready for the activity of tonight?
Yes, teacher.
Okay, perfect. Let me, I don't know what I did with this. I got bananas. While you were listening a little bit of Gilda's job.
Oh, yes.
Tonight we have an interesting activity. I told everybody that tonight we are going to give the explanation to Mr. Jones what was going on with him, with his situation, right?
Okay, teacher.
According to that, I'm going to show you a study, a picture, actually. And you're going to give me the explanation of that picture, okay?
Okay. Okay, teacher.
Can you watch my screen?
Yes, I can.
Okay, first of all, which kind of a study is this? Which one, I mean?
It's an US.
Yes, an ultrasound.
Ultrasound.
Which part of the body we are evaluating now? We got the diagnosis of Mr. Jones. It's very easy, right?
Yes. Yes, he have an hyperplasia. I don't think I say the correct one. Prostate.
Yes, HBP, right?
HBP. Exactly.
Okay, benign prostatic hyperplasia in English.
Okay.
If I show you this, can you identify the anatomical structures?
Yes.
Okay, tell me as much as you can.
We have to see the urine bladder.
Bladder,
Bladder. If there exists an I don't know how to say the.
No, just tell me all the things you are looking at this picture. Not the things you would see, just the ones you are looking now. Don't worry about the findings, the extra findings.
Okay. We can say we can look the prostate.
Yeah.
The developer of them, and it's a big prostate.
Yes, it's a great enlargement, right?
Yes. And it's regular.
Yeah. Similar to the one we evaluated during the digital rectal exam, right? You can see the bladder is full, yeah. The mass, the big mass. You can see the difference in colors, right? A little darker than this part. That's the difference between the mass and the prostate. The muscular wall, and that's all. No more details. We don't need some more in this view. Okay. When we make the measurement, we have the value and the volume from the vertical and transverse size, right? According to this volume, we decide the classification. Just for making a review, okay?
Okay.
Mr. Jones is coming to your consulting room and he tells you, Dr. Maria Tatiana, I went to your colleague and he gave me this report. And I'm very scared because I don't understand anything. His handwriting is awful. But I don't understand. He didn't want to give me an explanation about my situation. Can you explain it to me, please?
Okay.
Okay. If you want, we can take 3 minutes for reading this and organizing ideas. And then we can talk. Okay? It's better.
Okay.
It's different to give an explanation in Spanish than English, right?
Yes.
Yes. So let's organize ideas, and in 3 minutes at 7 and 10, we can talk about it.
Okay.
Okay,
Okay.
I'm here. I'm not leaving. Okay.
Okay.
Okay, are you ready?
Yes, teacher, I'm ready.
Yeah, perfect. So let's help Mr. Jones. He's scared about this information.
Yeah, so the report on the oceanographic study. We have a enlargement of prostate, grade 3, and we have a right renal cyst. I don't understand, teacher. What's saying in left kidney?
Okay, left
It's
kidney
grade
is normal, but this part, there is a lobe, I don't understand this, polar cyst. This is a polar cyst, we can say.
Okay.
On right, it says right kidney is normal in size, shape, and echo texture.
Mm-hmm.
So everything is okay in the right kidney. And the left kidney is the cyst. So in the conclusion, this information is wrong.
Ah, that's true.
Yes, it's shifted.
Mm-hmm.
Okay.
It's in the
So
left.
explain it to me. What means the 60 yes, the 60 ml?
I understand, but I can translate the letters. It's urine in the bladder, or
Okay.
I don't know if I'm corrected.
Yes. The urinary retention
Okay, the urinary.
is around this. Approximate is 60 ml. Well, we had the option in this case. Well, it's very easy, of course. And the patient said that he had some disturbances while starting, right?
Mhm.
That's the urinary rest, we can say. The urine that he cannot leave. But going to the report, what would you tell me? I'm Mr. Jones and I'm dying. I'm scared. Let me see, Dr. Maria, is that cancer? I'm scared.
No, we have to make a biopsy of the mass to analyze that if cells are malignant or benignant to onset a treatment.
Just a biopsy, or are you going to take me into a surgery? I'm not sure.
First, a biopsy.
How the biopsy is taken?
With a little incision. Well, that procedure that makes of a urologist. Well, he can do the biopsy through the endoscopic. I don't know how is the name in English.
Tell me in Spanish. Well, tell me if you want in Spanish, but you're talking to your patient. You cannot use medical terms at this point, right?
Okay, that's
So explain to him how the biopsy is going to be taken. He's scared.
Well, the specialist, the urologist, made a little incision and take a part of the mass, and he sent this tissue to the pathology department for the study of them of that.
Okay. So that incision, where is going to be? Because I'm chubby and I don't know. I have a big tummy.
Okay, it's gonna be in the hospital, or okay, in the part of the body. Did you?
Yeah.
I'm sorry. Okay. In the groin.
The groin. Is it painful?
No, the doctor used a premedical and anesthesia for don't feel anything.
Okay. Okay. Okay, Maria. Let's stop. Hey, time's up. I'm sorry. It's an interesting exercise, right?
Yes.
Because it's not the same to explain in Spanish. Your cat! What amazing. It's different to give an explanation in English.
Yes.
It's very different because you have to try to develop an empathy. And even though in Spanish is hard, imagine in English.
Yes.
In the door there. While finishing the workshop, I'm going to send you the same report. Then I'm going to send you the labs.
Okay.
And, well, of course, with guidelines for making this explanation to the patient. Write it down, a brief one. Okay, don't worry, don't give too much details. Don't get upset about it.
Okay.
Then the same exercise explaining the lab reports that I'm going to show you, and give me the general view of the treatment.
Okay.
If it's on the 3rd grade, as you said, he needs specific activities previously going to the urologist, right?
Yes.
So according to the information you sent me, we are going to work on the letter of referral on Tuesday, okay?
Okay. Okay. teacher.
Perfect. So let's wait for the homework, okay?
Okay. Thank you, teacher.
Okay, bye, Maria. See you Monday.
See you on Monday.
Bye. Hi, Jasmine.
Good night, teacher.
Good night. Well, you were checking a little bit of Maria's homework, of Maria's job, yeah.
The
So,
last one.
yes, well, let's go to this. Well, we actually with Mr. Jones, it's not a very hard job, right, to find the diagnosis according to the symptoms, the findings. We have the diagnosis and it's easy and it's clear, right?
Yeah, yes, teacher, it's a benign prostate hyperplasia, right?
Yes.
Mhm.
According to that, you sent, well, you gave him an order for an ultrasound. And
Mhm.
he's coming back to your consultation room with the picture and the report. He comes and tells you, well, Dr. Jasmine, I'm back.
Mhm.
This is my ultrasound, but your colleague didn't want to give me any detail. He told me to talk to you. I'm scared because I don't understand anything. Can you explain it to me, please?
Oh, okay, I will try, Mr. Jones.
I trust on you. Please, I'm scared. I think it's cancer. That's why he didn't want to tell me anything.
Okay, be calm. I'm going to check this report you are giving to me. So I
Okay.
will give you an explanation.
Okay, perfect. I need it. I'm scared. I have a wife and I have my grandchild. I don't want to lose them. I want to be away of them. Yeah,
I
yeah, it's so
understand.
dramatic. Yeah.
Yes, I was
Too much
about
drama.
to.
Okay, if I show you this picture, can you tell me which structures you can identify there? Just the things you are watching. Don't think on other findings.
I think it's in the left side. It's the bladder, if I'm not wrong.
Which one?
The left one.
The left one, this one? All of
Yes.
this?
Mhm.
Including
I
this
think
one? No. Just the black, right?
the one who's yeah, the black one.
The black structure, well, the black image is the bladder, of course,
Mhm.
but it's full of urine. Poor Mr. Jones, he had to stand the the desire of going to pee.
Oh, okay. It was a bladder ultrasonography.
Yes, a bladder ultrasound, well, a prostatic ultrasound. For
Oh,
developing this, you really
Mhm.
need to get the bladder full.
Mhm.
According to that, you can watch and you can make the measurement of
Mhm.
the structures you are looking for.
Mhm.
Do you remember during the digital rectal exam, we were talking
Mhm.
about a mass that was in the middle lobe, right?
Exactly. Mhm.
This is the mass, okay? Can you watch the
Okay.
difference in color? It's
Yeah.
little darker than the rest of the structures.
Mhm.
There is the prostate,
Mhm.
and
With
this
both
is the mass.
Mhm.
It's in the middle just. That's why I
Mhm.
like this picture. Just as a casualty, I found it and I said, this is the one.
The chose one.
Yes, you're the chosen. Come with me here. Let me take a picture. Yeah. So when you get this and make the measurement, you get these values. But the most important is the volume you find. According to the volume, you can infer the grade the prostate is developing, is becoming, right? According to the grade, you choose which treatment you're going to give or you're going to start. Well, all the activities you need. Do you remember I asked you to think about the general treatment of this?
Yes, yes, teacher.
Consider, well, you got an idea, right? You make a review of this. Just a reminder, in order to be clear on this case, because the diagnosis is done, it's very easy to make. In that order, considering all the possibilities, Mr. Jones is giving you this report. I'm sorry for the handwriting. I don't know who did it. It's on the internet. But I like it because it's very, it's going to the point, and it has abbreviations as I was showing you during the models. You have one here, another one here. Universal ones for making it faster. Of course, awful handwriting. So read this report. You can take, is that okay, 3 minutes to read it and organize ideas? And then you can explain it to me. I'm Mr. Jones and I'm scared. Don't forget it. Okay. So in 3 minutes, I'm here. I'm not leaving, but I'm gonna close the microphone. Okay.
Okay, teacher.
Okay. Okay, Jasmine, are you ready?
Yes, teacher.
Okay, perfect. I'm listening to you.
Okay. Well, after I review your report of the ultrasound, Mr. Jones, what you have is an enlargement of your prostate, okay? The normal prostate should have a volume of amount 20 to 25 cc's. So that's how we measure the size of the prostate with the study that you did. And in the case of the males that are the only one who have prostates, these structures, it's a normal enlargement through the years. So we have ways to see until what point this enlargement is it's normal or interfering with your normal activity. And by the clinic, we see that this is interfering with your normal activity. So in the report, we see that we have an enlargement of 50 cc's is the volume of your prostate, and that give us a grade 3 in the measure in the size that we classified. It's a grade 3. Okay, this is not malignant. It's benign, so you can be calm and be and receive the correct treatment. In this case, for that grade of enlargement, I will recommend a transurethral resection of the prostate, okay? This is not a big surgery. It is, most of the times, it's an ambulatory surgery, so you can be calm, you can be relaxed. Well, not relaxed, but don't worry, don't get worried about this. We can face it, okay, with the right treatment, and you can for the complainings while you get this surgery, you can also get a treatment, a pharmacological treatment for the complainings that you've been telling me you had.
Okay, so for being sure, because it's a lot of information, is that cancer?
No, that part you can be at least, we have one more study we have to make, that is a quantification of one antigen. It's the prostatic specific antigen that we have to measure first to be 100% sure that it's not cancer, okay? But with this result that we have right now, it's not enough. We need that study first.
Okay. Okay, Jasmine, that was clear. You've taken a deep breath. Don't worry about it. It happens. In Spanish, it's hard to imagine. In English, of course, it's harder, right? And given that the information explaining
Yes, I was
reports, all ideas run away, right? Okay.
Exactly, yes. I was trying to translate every word.
Yeah, don't worry about it. That's a good job. At the end of the workshop, I'm going to send 2 files. One file of the homework from the slides for practicing and checking and reviewing, of course. And a second file with the same ultrasound when you have to type or to write down this explanation in an easy way, of course, and the lab reports explaining to me the PCA, if there is an infection, and all the details I'm going to show you in the labs. And you have to give a general view of the treatment that you are proposing for this patient.
Okay, teacher.
Of course, in the 3rd grade of the hyperplasia, you need a specific treatment, right? You need specific activities to develop according to that. And Tuesday we are going to work on the letter of referral, okay?
Okay. Thanks, teacher.
So it depends on the information you prepare. We're going to prepare the referral to the specialty, okay?
Okay. Perfect, teacher. Thank you.
Okay, so have a great weekend, okay?
Okay, teacher, you too. Thank you. See you Monday.
See you Monday, bye-bye. How you go?
Hi, teacher. Good night. How are you?
Fine, how are you? Yesterday I didn't see you on the theoretical class.
Yes, I was having a shift and it was very bad in the emergency room. So I was going in, going out. I didn't stay all the class. I couldn't. My colleagues needed help with the patients, so I couldn't stay in class.
Okay, don't worry, it was an awful situation, I think.
Yeah, the normal I think, but yesterday was a little rough.
Okay, well, patience, it usually happens. Well, tonight I'm gonna send you the slides, okay?
Thank you, teacher. I appreciated that.
Yesterday I really forgot to send it to you. Now I'm realizing I didn't do it for you. But let me send them to you tonight. And well, you were listening a little bit of the Jasmine's report, right?
Excuse me? I didn't understand the last part.
Okay, when you get into, Jasmine was finishing her report on this workshop.
No, I didn't hear it. Okay.
No, don't worry. But well, we have the same exercise. Haha.
All right. Okay.
Can you watch my screen?
Yes, I can see it.
Perfect. Imagine that, well, you made the case report of Mr. Jones, the physical exam, that's well done, it's great. And you decide to send to him an ultrasound for evaluating again and checking the measurement of the prostate mass you found during the digital rectal evaluation.
Okay.
This is the picture of the ultrasound.
The basic ultrasound, right?
Yes, that's the transvesical ultrasound.
Okay, I can see it.
Can you identify the structures here, of course, right?
Yes, I can see it. It's very large.
It's very large. While, well, on the digital rectal examination, that was not so big, we can say, but developing this study, we can see that it's so large, right?
Yes.
We have the bladder, no cyst into bladder, nothing that looks so hard, so difficult. But now you get this report, this handwriting report.
Okay.
Imagine I'm Mr. Jones and I'm coming to your consulting room. And I tell you, hi, Dr. Iwa, I'm back. And this is the report from the ultrasound you were asking for. Your colleague, the doctor who developed this, didn't want to give me any detail. He said that that it's important to talk just with you. Can you explain it to me? I think it's something extremely wrong because he didn't see anything. I'm scared.
All right.
Okay. So
here
you are. Yeah.
Okay. Since the report of the transvesical ultrasound says that the prostate is enlarged, grade 3.
What it means? I'm not sure. Grade 3.
Okay.
I'm not sure what it should be. It's not too bad.
When we talk about the prostate, we have a classification about how big is the size of the prostate, and we have 4 scales: 1, 2, 3, and 4. But the doctor that made the ultrasound reports is in the grade number 3. It basically says it's very big. Okay. We only have 4 scales, 4 grades, and you have the 3rd one. So they always also say that at the end of when you urinate, what is left inside of the vesicle is about 60 milliliters. That's a lot. That's not normally for a patient.
So I'm not leaving all my urine.
Exactly, you retain some urine in your vesicle. So
Okay.
so that's kind of the problem, right? That's why you have the urge to go to you have nocturia, right? And
Yeah,
you
that's
have a very good
because
flow.
of that.
Yeah, that's the reason, right?
Okay, I understand now.
Okay, it also says that the kidneys are all right. They have a normal size, okay, a normal shape. And that's about the right kidney, right? So in the left, it says also this is normal, but I don't really understand when this
Okay, it says left kidney is
is
normal, but
normal.
there is a low, I'm not sure about this. There is a polar cyst,
Okay. Benign cyst.
benign polyp.
Benign polyp, right?
Yeah.
Polyp. Okay. But there's some kind of a mass in your left kidney, but it also reports that it is benign, that it doesn't invade the rest of the kidney. It's very focal in one section. And also in the last part, I don't know what this is.
That's the conclusion.
It's a conclusion, right?
Yes.
So in general terms, your both kidneys are all right. There are no data that you have a kidney disease, only the cyst and the polyp in the left kidney, but your prostate is very enlarged. It has a big size that's not normal. That is making you retain some urine when you go to the bathroom to pass waters.
Okay, so tell me, I'm scared because I didn't imagine a situation like this. Is that cancer?
Okay. It's not always enlarged prostate. It doesn't always mean that you have cancer. We have to do a biopsy to
Biopsy.
benign of it has cancer, right? So a lot of men at your age has this problem. It's very common, but we have to study. We cannot leave it like this, okay?
Okay, so you're going to take a biopsy. How that biopsy is gonna be taken?
Okay, we have well, basically we have two options. We go to the rectum and also we go to the urethra, right? All procedures we do it in the hospital. We have to get inside of the hospital. We have to give you a anesthesia, right, to perform this procedure. So you have to stay a couple of days or to check if you don't have any more bleedings after the surgery, right? And have some antibiotics in your like part of the treatment inside the hospital and also when you go to your home. I'm gonna have the results by the pathology to confirm. I'm gonna call you to check a new let's say date. No,
A new appointment.
a new appointment. Okay, and we're gonna discuss the results of the pathology. Okay.
Okay, so you are going to develop the biopsy.
No, I'm gonna have to call the urologist to present the
Urologist.
yes, we're gonna have to make an appointment with him. He's gonna explain you a little more about the procedure. Okay.
Okay.
More doubts, he can answer them to you. Okay.
Okay. I understand a little bit better, but I'm scared. So if everything is normal, I'm going to surgery, right?
Okay, and in this case, some patients have a little relief with some kind of treatment, but that's when we talk about patients who has enlargement grade 1, grade 2, grade 3, and grade 4. It's almost it resolves by surgery, right? So in this case, it's gonna be in the urologist's opinion. Is we're gonna act right.
Yeah. He's going to the site, so
Yes, he's
That's
gonna talk to you about the options of the treatment, okay?
okay.
He's gonna talk to you about the treatment like like the operation or the other treatment that likes by pills. And he's gonna talk about the efficiency,
Talking about the efficiency of
Both.
treatment.
Yes, so that's you're gonna both are gonna talk about it, and you're gonna decide which treatment is better for you. By medicine, the best option is in this type of cases is radio operations, but you have the last vote to decide which treatment you refer. Okay.
Okay, well, I didn't expect this situation. Well, let's have patience, right?
Yeah.
At this point, am I going to start any treatment, a pill maybe?
Yes, we're gonna start a treatment until you go to the urologist to check you out to have a look at your tests. Okay.
Okay, perfect.
And meanwhile, we're hoping that the treatment is gonna make you feel better, to have less symptoms, and we'll have to wait about his opinion. Okay, he's gonna tell you more about it.
Okay, thank you, Dr. Hugo. Well, I'm still scared, but now I understand a little bit of this. Is that correct if I look for information on Google?
Okay. You can look for information, but you have to be very careful which kind of text, which it has biography, that is a serious text or information about it. There's a lot of information in the internet, and not all the information, all the text, all the books are accurate. Okay, there's a lot of information, so you have to be very careful what you read. Okay.
Okay, but well, I'm not sure if I can identify the correct text.
Okay. There's okay. In order to understand this pathology, you have to have a little of medical knowledge for this, because some texts are very useful, but there are a lot of medical terms that is not easily understand, right? And there's a lot of people who made texts or videos or something like that can misguide you from that. So we don't always recommend to search on the internet about what kind of treatments or what kind of information you can have it, because there's no way we can verify that the information is all good, or they can make you worse. Okay. People on the internet, they say that you can take this, take this pill, take this treatment, eat this vegetable, it's gonna help you. Most of the times it can harm you, it can make the things worse. So we always say that you should go to your doctor. If you want to have a second opinion, you are entitled to also. Okay.
Okay, thank you. Okay, Hugo, good job. Well
Thank
done.
You,
You do it great. That's the idea, of course. Practicing the expressions, how to give that kind of information, right?
Yes, it's a little bit hard because we always practice with patient on English.
Yes, imagine that in Spanish it's hard to give information. Of course, in English is the worst.
Yeah.
It's not as easy as expect, but
yes,
well.
in the hospital where I'm working, we got a lot of patients that are from other countries, and English is the easiest part, but medical terms is a little bit hard to make them understand what we are trying to say.
Yes, the translation, right?
Yes.
Yes, that's objective. You gotta practice this. And well done, good job.
Thank you, teacher.
According to that, well, I think, well, it's properly to tell you. Today, I'm gonna send you the slides. Give me some minutes, please.
Thank you, teacher.
And I'm gonna send 2 homework files, one from the slides of this week for preparing to the final test, checking vocabulary, right? And a
Okay.
second file with the same ultrasound and report and the lab tests.
Okay.
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 Prepare the information you gave me at this time, write it down in a brief paragraph. Give me the same explanation, okay?
Okay.
Organize ideas, improve in the way you consider it would be properly, okay? And explain me the laboratory results. I'm gonna send some reports, the PCA, the sample of urine, blood, well, many things that we need on this patient.
Okay.
And according to that, you give me the explanation, okay?
Okay, perfect, teacher.
Moreover, at the end of this, add the treatment you propose, just a general one, in the way you consider it properly, because according to the information you prepare, we are going to work on the letter of referral on Tuesday.
Okay, teacher.
Okay?
Okay.
We are practicing about this explanation because it's a similar paragraph you send in the letter of referral. That's why it's a good way to start practicing on this.
Okay.
Okay?
Okay, teacher.
Perfect, Hugo. So have a great weekend. Keep on reading, on studying, and at the end of the workshop, please, I'm gonna send all the files, okay?
Okay, teacher. Thank you.
Okay, you're welcome. Have a great weekend. It's
Thank you,
nice to
teacher.
talk to you.
Thank you. Have a good night.
Thank you so much. Bye-bye. Okay, at this point, I've been working with my as usual students. I'm expecting for Carla Suarez. Let me check. Yes, she's supposed to attend now. She's 5 minutes late. Well, I'm coming back as soon as she gets into. Bye-bye.
Hi, teacher.
Hi, Carla. How are you?
I'm good. And you?
Well, good. It was a busy day, but now I'm here. Yeah.
Sorry, I'm late. I was reading the slides of yesterday.
Yeah.
And
Well, is there any question, any specific detail, maybe?
no, I was reading and I understand almost everything, but no, not a question. I believe it was a easy lesson yesterday.
Yes, very theoretical, I think, but it's not so hard, right?
Yes, no.
Okay, let me see. I received your explanation about the case report and the physical exam.
Yes.
Well, let me see if I can rotate this. No, it's not letting me to do it.
I believe that the second one I sent you, it was better because in the first one I didn't understand, but then when you explain me, I think I did it better.
Yes, it's better. Actually, it's the job I was expecting. Take information from the case I sent to the group.
Yes, at first I didn't understand.
Yeah, don't
So-
worry about it. It usually happens. It's not such a big problem, we can say.
Okay, thank you,
So,
teacher.
I'm opening the file, please. Let's read it together because it's important to get it
Okay.
corrected.
Okay, that's
Let
fine.
me, let me change the position because it's not possible to read in the PDF. Okay, I'm gonna share a screen and we read it together, okay? Case report. Can you watch my screen?
Yes, teacher.
Okay, when we talk about, well, when we talk in English about the case report, the historia de la enfermedad actual,
Mhm,
we must consider details that are very different from Spanish.
mhm,
In Spanish, you have the chance to write down again the name because, well, it's a requirement.
mhm.
Because of the structure, we are used to do it,
Yes.
right? But in English, of course, it's not the same. It's very different to make it. In the guidelines I sent, and we were talking about it, there was a specific point about the general data. In the general data,
It was JJ.
yes, you don't have to write down the name again. Even
Yes.
though patient, this abbreviation is not necessarily.
Okay.
Just, you have the option to say JJ, just capital letters,
Mhm.
just a 75-year-old with hyphen.
Okay.
Why with hyphen? Because when you use the hyphen,
Mhm.
you're telling edad.
Okay.
When you say without the hyphen, this is años.
Okay.
That's the difference while translating and catching the meaning, okay?
Okay.
Well, in order, you are not giving me the name or the gender of the patient. If you just give me the occupation, I cannot infer if it's male or female, right?
Good.
Here you can add male rentist, and that's all.
Okay.
That's your general information. You don't need more details about it, not pathological antecedents, anything about family, treatments, medication. That's not important at this point. Why not? Because you have a specific chart ahead talking about all of these details. At this point, we have to talk about the complaints. Okay? About the symptoms he's describing.
Oh, okay.
When you start the paragraph, you have the chance to give me an introduction why the patient is coming. I mean, the main complaint.
Okay.
The patient complained of trouble going to the toilet, nocturia, and urinary incontinence. He doesn't present more symptoms or complaints.
Mhm.
Here you're random information. Why? First of all, you have to speak everything in past time, nothing in
Okay.
present. If in grammar we make this mistake, talking in present or maybe in future, because it could happen, a confusion is human, a human mistake. But it's not correct. Always in past.
Okay.
You can say
Complained it?
yes.
Okay.
Complaint of, or you can say now patient actually it's not properly to use this abbreviation because it's present in Spanish, in English.
Okay.
In Spanish, we abbreviate like this patient.
Mhm.
The patient, I don't know where I am. Well, the patient complained of, or you can say the patient came complaining. I'm sorry, my typewriting is awful.
It's okay.
Complaining of, or you can say patient. The patient came to the consulting room complaining of every time in past, right?
Okay.
So you can see the difference. It's different to speak from Spanish to English.
Yes.
We have some other expressions to talk about the complaints in the slides. Check all of them and reorganize, okay?
Okay.
Complaint of trouble going to the toilet. When you say going to the toilet, as a general, as a common expression, we understand that the patient is going to make poo, not pee.
Okay.
It's different, right?
Yes, completely.
Complaining of when you start talking about the complaints, the symptoms he's describing, you have to use only medical vocabulary, non-common expressions, okay?
Okay.
Complaining of, he says,
Oh.
frequency, I mean, pollakiuria, nocturia, and urinary incontinence, right?
Oh, okay. Okay, teacher.
Incontinence. He doesn't present, it's again in present, right?
Hmm.
You can say, you cannot say that he's presenting because you are not watching at them during the evaluation. This
Yes.
situation, he's just telling you what's going on.
Okay.
He did not refer. Well, he did not refer. He says he's denying information.
Mm-hmm.
Refer, look for, there are 3 symptoms that he's denying, and they are into the dialogue. He has more information to complete about the things he's denying, okay? Look for them.
Okay.
1. About the physical exam. The abbreviation when we give the announce, we can say, when we say that we are starting the physical exam, is this OE, on exam. The same as the chart I send it to you. I have to say vital signs and send all of them. Temperature is correct, BP is correct. The pulse 8, it's in Spanish.
No, I didn't know if I had to invent it or just
No.
copy. So
No, the values are okay, so don't worry about the values. The number, no matter, but the abbreviation is not the one we were checking. We have the chance to use BPM, beats per minute, or just slash and min, right?
yes.
The way you are expressing this idea is not the one we were talking about. That's why it's important to correct it, okay?
Okay.
Going just to the abdomen is correct, because if there is no situation related to the main complaint, it's not important to give the information. Perfect.
Mm-hmm.
Abdomen, no palpable mass or pain.
Or just NAT?
Normal. Oh, I'm sorry?
No, nothing. Okay.
Okay. I give you some information with the abdomen, right?
Mm-hmm.
It was prominent. So the patient is chubby.
Mm-hmm.
Gordito. But there is no mass, okay. But you can say during palpation, pielorheural points, superior and medium, right superior medium with little pain, right?
Mm-hmm.
Then we have the lumbar percussion. Do you remember that? It was pain again, the right one.
Mm-hmm.
Following this example, write it again. Lost control of the bladder. Did you evaluate this? Did you can watch this? No, I didn't give you this information.
Mm-hmm.
And well, according to the information I give you, write it down again, okay? And send me tonight the answer, because we need to correct it for going to the next step.
Okay.
The next step is the description of an ultrasound and give me the reading of an, well, give me the explanation about this report. Okay, Carlita?
Hey, teacher.
Okay, check it again, do it again, and according to that information, we can go to the next part because we cannot take too much time on this part. Okay?
Okay, teacher.
Okay, perfect. So I'm
Okay.
going to wait for your answer, and according to that, we are going to go ahead, okay?
Okay.
Okay, Carlita. So see you,
Okay.
man.
Thank you, teacher. See you. Have a
See
good night.
you. Have a good night. Bye-bye. Hi, Jorge.
Good evening, teacher. How are you?
Well, fine. How are you? How do you feel?
I feel well, thank you.
That's great. Well, you were watching a little bit of the physical exam of Carla. We needed to review
Yes.
this. Let me open your file to check your answer, okay?
Okay.
Okay, so give me a minute, please. I'm opening the file. I downloaded it.
Okay.
Ah, I have too much windows opened.
Yeah, you have too much students, I guess.
Yes, actually we are 17.
Yeah.
Okay, let me share the screen. Yeah, yes. Can you watch my screen?
Yes, I can see it now.
Okay, this is your case report and I like it. The findings on exam: temperature, oxygen saturation, no. Well, we are going to check this. BPM per minute. Okay, perfect. Vital signs are great. Thank you. Going to the, well, when you prepare a physical exam and report, in your country, do you prepare like a list?
No, I usually don't prepare a list. It's just like let's say let's say it's a paragraph in which I just mention all the findings, let's say.
Okay, that's okay. Don't worry about it. Just reorganize as a paragraph, okay?
Okay.
Just let's check the information, the most important part. Abdomen prominent, okay? Mild pain, hypogastric touch. When you say touch, you are being careful. You are not palpating. You are not looking for. Right? You touch by a superficial maneuver. When you palpate, you make pressure on the abdomen, on the structure, and you look for pathological structures, right?
Okay. I didn't know there was that difference between touch and palpate, but I'm gonna add that.
Just change. Don't worry. Mild pain, hypogastrium during palpation, or you can say on palpation and then mild pain, and that's okay.
Okay.
No palpable mass, okay. Right. PRU points, perfect. You're the only one who used this abbreviation.
Okay.
No one did the same.
You know, actually, I used it was just kind of an instinctive use of an abbreviation because I didn't know if that was. I just took the risk to abbreviate that way in that way. Let's say.
That's great. You're the only one who did it. You got the idea. There are general information, very, very common expressions that we must use. Well done, Jorge. I told you I trust your job. Supine mind.
Thank you.
Mild pain. Right lumbar, percussion, painful, perfect. The dray, only 2 students, you and one of your colleagues made the same. Rest of the people.
Okay.
That's great. Size, NAD, residential contours, big palpable mass on prostate, no blood, no pain. Just say no blood or pain. That's enough. This is rounding. Avoid this, okay?
Okay.
This is not necessarily. Just no blood slash pain, no blood or no blood, neither pain. That's enough.
Okay.
Okay. So reorganize it as a paragraph without just with the details we are talking about, and that's enough. Okay.
Okay.
Perfect. Let me share you the next screen. It's the hardest, yeah.
Mhm.
Well, actually, you were asking for if that was possible to give information or diagnosis just watching a picture or X-rays, right?
Yes.
And I told you that, of course, it's possible to make it. Imagine you were evaluating Mr. Jones and you decided to ask for an ultrasound because it's part of the protocol to ask for this study.
Yes.
And then Mr. Jones is coming back to your consulting room with the ultrasound report. And he tells you, hi, Dr. Jorge, I'm back again. And your colleague didn't give me any detail because he told me that the only one who can explain it to me is you. Please, here you are the picture. This is the picture, just for general information.
Yes.
I don't understand the picture. Please explain it to me. Just give me the anatomical structures you see here. Don't worry about possible findings, just the ones you see.
Okay. Actually, if I'm being honest, I don't identify any structure in that picture.
Perfect, don't worry about it. You are at the beginning of the career, but that's the question I made everybody. This is the abdominal wall.
Okay.
Muscular tissue, fatty tissue.
Mhm.
Our patient is chubby, that's why it looks so big, okay? This is the bladder.
Okay.
It
It
has
looks
to be,
thick.
yes, it's the
Uh-huh.
bladder, it's full. It must be full. If it's without urine, it's not possible to check and to identify the borders of the structures. I mean, in this case, the prostate. Can you see the difference? The darker space, right?
Uh-huh.
And the white space. Little
Yes.
lighter, right? This difference is showing you that this darker one is a mass that has not to be there. And then we
Yes.
have another view, a transversal view, and we are checking the measurement. According to this measurement, we collect this information and the volume. The volume is one of the most important parts because according to the volume, we can classify the diagnosis of our patient, right? At this point,
Yes.
well, checking the information I sent you with the dialogue and the physical exam, did you catch the diagnosis? Is that possible to infer what is the situation?
Yeah, I think it's like a prostate enlargement. Let's say it's I would say it's a hyperplasia, right?
Perfect. Yes. That's the diagnosis. And then,
But again, I don't know if that's with the, let's say, with the symptoms and the findings, we can infer if it is like benign or malignant, a tumor. Like,
I'm gonna send you the picture of a malignant prostate. That's benign. There's no way of missing this information.
okay, teacher, one question.
Yes.
Is there a like, let's say, a criterion to understand when you see that when you look at a radiography, for example, you know that if you see you know that if you see a dark part, then that is radiolucent, right? So that's why you don't see it. And if you see it white, it is radiopaque. So does that something similar to that happen with the ultrasound? Like in order to identify if what you are seeing is liquid or if it's something solid.
Of course, you have the scales in color. I mean, the radiolucent to radiopaque scales. And according to the information you collect, you can infer the process that is present. but it depends on the clinical findings. That's why we give some specific details when we ask for that kind of studies. On the other hand, it depends on the shape, on the rounded structures, on the satellite images we can find. Moreover, it depends on the, well, on lots of situations according to the structure we are evaluating. For example, if we evaluate a chest X-rays, well, there is too much information to get in contrast, and according to that, we can think on some specific diagnosis.
I understand.
It's a
So,
little
but
bit
let's
hard.
let's
Yes,
suppose that you are looking at that picture that you showed me, that you just showed me. Would you know that that is a prostate if you didn't know that the ultrasound is from the abdomen?
yes, of course. I know it's a prostate because I have the bladder here. If I can
Okay, so it's
identify these structures, if I just receive this part,
mhm,
because of the practice, I have to be able to identify the biggest organs at least, and the walls. The abdominal wall
okay.
is the same every part of the body, and the bladder is the same no matter the cord, the position you use is the same picture. Of course, changes the position, and that's all. But
Okay.
this one is possible to see. Why I noticed that it's the prostate, because prostate has this little light color. It's just by practice when you memorize these patterns.
Okay. Yeah, I understand. So there is a way to understand what structure you are watching, let's say.
Yes, yes. As I was telling you in previous workshops, I had the chance to have a specific topic during the medical school where just watching pictures, X-rays, CT scans, I had to give a diagnosis. That's the imaginology class. And it was so fun because
Yes, I
you
understand.
must read and look for in books that patterns and compare and get in practice, watching and practicing. Because sometimes, because in Cuba there are not the same resources, you only receive the picture with the measurements, and you have to memorize what
Okay.
you're looking for. And according to these values, you have to give a diagnosis and give an explanation. Or on the other hand,
Yes, I understand.
received reports like this with awful handwriting and just watching, you have to try to translate the information for helping your patient to take a breath and consider that it's not a wrong, extremely wrong situation. So you can practice on this. It's possible to make, of course, but patience. We really need
Yes.
patience to do it, right?
Yeah.
Patience and practice. That's why in Cuba they said that a good student is the one who gets into the hospital, previously the sun, and leaves the hospital when the moon is on the top.
Yeah.
So
I
you live.
understand that saying.
Yes, that's the way. You live in the hospital and you practice. As much patience you can evaluate is the best for you. As much as you can read is the best. But of course, focusing on the topics you are working at the moment for not mixing information, not getting mad.
Yeah, exactly.
Yeah. Don't worry about it, Jorge. You're doing a good job. You are at the beginning. Enjoy this beginning as much as you can, because this is the basis. If you have a solid basis in knowledge, the rest of the career is going to be easiest. The basis is one of the most important parts now.
Yeah, it's just that sometimes it happens to me that it's so exciting to when you start to understand something that is like you don't want to stop, but you have to stop at some point because it's too much information to put it in your brain just in one time. Like, I don't know if you get the feeling when you get too excited
Yes,
about that
yes.
topic.
I completely understand you. That was the same with me. And my first 1 to 3 years of career, I had two professors who encouraged me to stay at the hospital with them, practicing everything and developing surgeries and things like that. But they also told me that the basis was the most important part and my obligation was to study with them. They were with me, checking books, reminding, and that was amazing. That was nice.
Yeah.
Yeah, don't worry, Jorge. Okay, I'm gonna send you a file showing you the homework of this weekend, okay? Let
Okay.
me send you the pool to take attendance. And don't worry, just correct the details I showed you on the physical exam, okay?
Yes. Do you want me to send it in a PDF file or just a picture?
The way you prefer, that's okay for me.
Okay.
PDF is okay?
Yeah, it's okay. It's very easy to convert the picture into a PDF file.
Okay, perfect. Okay, Jorge, so take a deep breath, and at the end of the workshop, I'm gonna send you all the files you need, okay?
Okay, thank you, teacher.
Okay, have a great weekend. Bye-bye.
You too, bye.
Bye-bye. Hi, Amy.
Hi, teacher. How are you today?
Well, it was a very busy day, but we are here. But at this point, I feel great. Well, dear, we were talking about Mr. Jones. Do you remember him, right? And today we were supposed to evaluate his findings, his labs and imaging tests and everything, right?
Right.
Imagine that I'm Mr. Jones and I'm sorry, I pushed the stop. And I'm coming to your consulting room with my ultrasound report. And I tell you, Dr. Hamey, I'm back again. And I'm so scared because, well, I went to your colleague. He developed the ultrasound and gave me this picture. And I certainly don't understand anything. I think it's awful because he told me that you are the one who's going to explain it to me. Can you help me, please? I think it's cancer. If I show you this picture, just identify the anatomical structures you can see here. If there's possible. It's not possible, don't worry. No, there's no trouble. No problem, okay?
Okay. I guess it's a prostate. Well, I suppose.
Yes, that's the prostate. You have here in the, I forgot the view. Well, no matter. That's the prostate, the abdominal wall, and the bladder, whole bladder. Poor Mr. Jones, he wanted to go to pee, but he must wait. When we get the second cord, the transverse cord, we get the measurements. When we got these values, when the most important is the volume, right? According to this, Mr. Jones is inspecting, and he shows you this report. And he tells you, the doctor also gave me this report, and I really don't understand. His handwriting is awful, but I think you could. Can you help me, please? As you can see, here we have abbreviations, more abbreviations, the general ones. That's why it's important to check and be related to them, because it's very common to find this kind of expressions, right? In that order, read it, organize your idea, and let's help Mr. Jones to take it easy, okay?
Okay. I don't understand a lot of words in the handwriting.
teacher. I'm sorry.
Okay, tell me the ones you don't understand. For example, I'm gonna read prostate greater enlargement with significant medium lobe enlargement. PIR approximately 60 ml. Right kidney is normal in size, shape, and ecotexture. Left kidney is normal, but there is a, I don't know what it means, I'm sorry. There is a polar cyst, benign polyp. Conclusion, we can say, greater enlargement of prostate with, he says right, but it's left renal cyst. Okay?
Okay.
Okay, so Dr. Hamey, I'm scared. I'm a grandfather. I want to check my grandson grow up. Is that cancer?
No, it's not. It's not cancer yet.
Yes, so it's gonna be.
We're gonna send you treatment and we're gonna evaluate again later.
Later, how many time we are going to take for this?
I'm not sure, teacher.
Okay, don't worry about it. Okay, try to explain this report. When we get, well, this is the volume of urine that Mr. Jones is keeping into the bladder. 60 ml is too much. That's why he's running with nocturia and urgency and frequency, I'm sorry. Because of this value, it's not easy for him to stand. Moreover, this cyst, at this point, we cannot infer if it's benign or not. It looks like a polyp, but it really needs to take more studies. Right is okay, left is the trouble. With the greater, the treatment is surgical. At the beginning, you try to control the situation for not becoming to the 4th grade with pills, with the, I forgot now why my mind is running crazy. With the sonda vesical, yeah, you have to control this extra volume. You have to place this device. You have to explain the patient he really needs this for controlling the nocturian frequency. And of course, you must send this patient to the urologist for taking the final decision about the surgical procedure, how many times they're going to expect. Usually, you start pills by 6 months, and according to a new ultrasound or CT scan, if there is a change, if it gets back to the 2nd grade, you can avoid the surgery. It could happen. If in that 6 months, the symptoms of frequency, nocturia, urgency can be controlled, you can take out the device, the urinary device. I forgot the name. What's wrong with me today? Well, no matter. So it's depending on the situation. You can explain the patient that this is the reason why he's running to the bath at night, why he's with nocturia. You can explain that the left kidney cyst is a finding, non-expected finding, that we need more studies. And because of this enlargement, you need to refer him to the urologist. And the urologist is the one who's going to decide the medication and the rest of the treatment, because now it's the moment to ask for an expert's opinion.
Okay.
Okay. Don't worry about it. Okay, tell me. Give me the speech. I'm Mr. Jones. I'm scared. Let's practice. In Spanish, it's not easy to give information. I understand you. In English, of course, it's harder. But we have expressions to translate to the patient's vocabulary. he's a rented, he's elderly. He thinks that he has cancer, but actually we don't know. The urologist is the one who has to talk about biopsy, surgical procedures, and the rest of the things we need. It's not the moment to you to scare the patient about that procedures.
Okay.
When you have this value in elderlies, you usually have a urinary infection, right?
Okay.
That's the part you are going to develop at home, according to the lab reports I'm gonna send at the end of the workshop, okay?
Okay.
Take a deep breath. Don't worry about it.
I'm panicking right now.
Don't
It's-
worry, it happens. I understand you completely. Imagine in Spanish is hard, of course, in English is the worst.
Okay. Okay, Mr. Johnson, the reason you go more often to the bathroom at night is I can't, teacher. I'm panicking.
Okay, I understand. Don't worry, you became on panic. You didn't expect this activity in this way, okay?
I'm not prepared at all.
Well,
I'm
actually,
sorry.
no, don't worry. I understand you completely. Just as a story when here in La Paz, I was working in a hospital where we were used to receive travelers, just travelers, non-Spanish speakers. Even though sometimes translators were coming with the patients because they didn't speak English or Spanish or something similar. Once I got a patient with influenza. He came from Peru with that infection, and he was from Poland. He didn't speak English, of course, didn't speak Spanish, and the translator was not so good in Polak language. And I ran crazy because I was not sure how to talk to him. And well, I got in panic when I had to give the explanation from the x-rays and why he cannot breathe here in La Paz. Of course, the attitude is one reason, but the infection was the worst because his lungs were awful. That's why I understand completely that it's not easy.
Okay. I'm
When
so
you get-
sorry, teacher. I'm so
No,
ashamed.
don't worry. It happens. It happens. Take a deep breath, and you're gonna send it to me by written, okay? Handwriting.
Okay.
The weekend. The explanation. Imagine you are giving this information to Mr. Jones. Here you have medical information. For example, echo texture, in size, in shape. That's expressions that patients are not used to. Translate them into the common words. We are going to make the opposite and tell me that everything is okay by your opinion. And you have you have to refer me to the specialist, okay?
Okay.
I gave you the keys. I gave you all
Next week we're
information.
gonna work in the letter of referral, right?
Yes,
Or it's gonna be in this homework.
yes. On Tuesday, we have this activity. I'm gonna send at the end of the workshop 2 files. One about the slides for being prepared for the final test because we have 2 weeks more. And the second file with the ultrasound I showed you, the picture and the report. And then the lab reports, the labs, all the findings in the laboratory tests.
Okay.
And you have to give me the information from the ultrasound and then the laboratory test, okay?
Okay.
The same, you are talking to Mr. Jones, don't worry about it.
Okay, teacher.
Okay, have a great
Okay.
week, Amy. Don't worry about it, it usually happens. Don't be ashamed of this, okay?
Thank you, teacher. Have a nice weekend.
Have a nice weekend, bye-bye. Hi, Dr. Carlos.
Hi, teacher. Good evening. How are you?
Well, it's very long day, I think, but so we were working on the physical exam, case report. Do you remember that, right?
Yes, teacher.
And your job was okay, so I liked it. And in order I was explaining to you in the previous workshop, tonight we have a specific activity. And well, we agree that the patient is not complicated, doesn't need an admission at the hospital at this moment, right?
Okay,
Can you
teacher.
hear me, Dr. Carlos? I'm sorry, I cannot hear you so good.
Hi, teacher. Can you hear me?
Yes, now I can hear you clearly.
Okay, teacher.
Okay, so imagine I am Mr. Jones, and I'm coming back to your consulting room with this picture. And well, listen to me. Hi, Dr. Carlos. I'm coming back to you. I went to the sonographist, to the doctor who developed the ultrasound, and he gave me this picture. And I don't understand anything. Can you explain it to me? He told me that you are the one who's giving me the information.
Oh, okay. And that's US?
Yes, an ultrasound, yes.
You can see a big your prostate is biggest.
Is the biggest one? Wow.
How old are you?
75.
75. Okay. Sometimes in that age, many male people cold. I don't know in English.
Right. Tell me. If you prefer, tell me in Spanish and we can correct it.
Yes. Many male people in his age with his age have prostatic hyperplasia.
Oh, so it's normal to my age. It could happen.
It's not normal. You can do it others laboratory exams. For example, the I don't know in English, PSA.
The PSA, prostatic specific antigen.
Yes. And with the results, I'm Darle.
I'm gonna give you
a specific diagnostic. I do not.
Diagnosis. Okay.
Yeah, I don't know.
Okay, but let me tell
Can
you,
you
also the doctor who developed the ultrasound gave me this report. Can you explain it to me? Because the handwriting is awful and I understand lots of words, but there are some expressions that make me scared. I think it's cancer. I'm very scared. I'm a grandpa. I want to see my child son to grow up.
I forgot asking about the urinary incontinence.
Yeah. Don't worry about it. At this point, the patient is giving you the report of the ultrasound study. And following this report, explain the patient what's going on. Just for practicing the way of talking, doctor. Don't worry about all the context. You are explaining him this report. You cannot leave him just with the medical terms, right? We have to convert our language to the common language for making it easier for him.
I am, in her example, I am talking with the patient, right?
Yes, you're talking to the patient.
Okay, teacher. In
Yes, I'm
Spanish,
the patient at this moment. I'm Mr. Jones.
yes, teacher. In Spanish, it's similar for me. In the medical terms.
Yes, of
Sí.
course, but you got this situation lots of times, I think, because of your specialty, right?
Yes, teacher. And in our people is very difficult understand me. Yes.
Yes, I really understand this situation. It's not easy.
Yes, Quechua and English.
Yes, you must get these two languages.
Yes, in Sucre, the people talking Quechua.
Yes, that's the area. And in Quechua, I think, well, it sounds nice, but certainly the information couldn't be always in the same way.
Yes, teacher. Okay. And when I am talking with the patients, the words should easy for the patients.
Yes, to get the patient in calm, relaxed, because the patient thinks it's cancer. In order, the doctor who developed the ultrasound, the imaginologist didn't say anything. The patient is scared at this point.
Okay, teacher.
You get the prostate in the grade third and
Grade
the third
three.
grade
Yeah.
enlargement with significant medium lobe enlargement. The same in the digital rectal examination, right?
Yes, teacher. Yes.
It's so big. The urinary volume that is being into the bladder is 60 ml. Right kidney is normal in size, shape, and echo texture. Left kidney is normal, but there is, I'm not sure about this. I don't understand the handwriting.
Yes, the medical letter.
Yes, it's awful. But there is a polar cyst, and the doctor says benign polyp, according to the imaging.
Okay.
Conclusion, grade third enlargement of prostate with, he says right, but it's left renal cyst.
Enlarge, teacher, sorry.
No, enlargement.
Spanish.
Grade third enlargement of prostate with left renal cyst.
Okay. Yes. Right renal cyst.
He says right, but on the description is on left.
Left. Okay. Yes.
Yes,
teacher.
it's mixed, but don't worry about it. It's just a detail for this example.
Yeah, teacher.
So how you could explain this situation to an elderly patient? Of course, you have the idea in Spanish. Try to exchange it into English. We are making the opposite, not translating the common English to the medical English, right? We are going back to the medical, to the common.
And yes, teacher, and it was correct. Say the biggest prostate.
Yeah, well, it's according to your experience. It's one of the biggest ones I watch. It's a big prostate according to the classification we have at this moment. Or you can say we have the scales for this classification. At this point, for prostatic hyperplasia, there are 4 grades, and you are on the 3rd one, on the 3rd step of this scale, so it's too big, something like that.
Interesting, teacher. I like it.
Yes, it's
That
nice, this
example.
exercise, right? Nobody
Yes,
expected to work in this way tonight.
yes, teacher. Congratulations for this example.
Oh, thank you so much. Thank you.
I
That's the
like,
best way
yes.
of practicing.
I need that more examples.
Yes,
Yes.
that's the idea. In previous courses, I was asking for students to bring a personal case, maybe a patient, something like that, that they prepare by their own, but it's not working. That's why in this course, I prepared to give you the case, to give you the situation, and you are talking to the patient. Yeah.
Yes, teacher. Yes, it's excellent. That examples.
So now try to give me the explanation, doctor. It's possible to do it. Stop thinking on Spanish.
Yes. I am talking, teacher. I am talking.
Yes, yes, I can hear you clearly.
Well, Mr. Johnson.
Yeah.
In the US, in the US or ultrasonic.
Yeah, the ultrasound.
Ultrasound, no? Yes.
Yeah.
Ultrasound. Report. Do you have a big prostate?
Okay.
There is. I don't remember. 4 grades.
No,
And
3rd grade. A 3rd grade.
yes, there is a 4 grades, and you have grade 3rd.
Okay. So it's big.
Yes, the meaning that results could be CA, could be cancer. I don't know. Pobre paciente.
Actually, so it's a cancer? I don't understand very well.
Yes. It's possible. And first, do you need others laboratories?
I need more tests. Okay.
Yes, a blood exam. When I am need others laboratories, for example, PSI is a exam about about his prostate.
Okay.
I don't. And others exam is about tumoral marks, maybe. I don't know,
Tumor
teacher.
markers. Wow.
and that results. I don't know, translate, teacher.
Try to do it. Don't worry. Your colleague is not attending, so let's continue. We are on track.
I don't know, teacher, quiero decir que con ese resultado vamos a determinar si es o no cáncer.
Okay. You can say, with that lab report, with that lab result,
Lab
we can
report.
determine if there is cancer or not.
Oh, sí.
Yeah.
Teacher, thanks.
Don't worry about it. We are here for practicing.
Can I say if you lab report say me, no, I don't. A mi español estoy queriendo traducir.
Don't worry about it. It happens. We must practice how to express these ideas because I think it's an objective of this course, right?
Yes, teacher.
Maybe we cannot get all the confidence we need, but at least we have an idea how we are going to talk.
Okay, teacher. If you report labs is altered, I don't know. Is not normal.
Okay.
It's not normal. Maybe you probably have cancer. I don't know.
There's so bad news, doctor. I'm getting scared.
Don't worry. I want no. My vocabulary is lost.
Don't worry, it happens. Actually, one of our classmates get upset about it and couldn't tell me anything. She was scared about giving me information. Don't worry, that's okay.
Yes, teacher.
Yes, I think nobody imagined when I told everybody that today we were supposed to talk in this way, to give me the reports of the ultrasound or imaging tests and laboratory tests. But, well, I understand. It's difficult to sometimes giving information in the Spanish is difficult. Imagine in English is harder. So don't worry about it. It happens.
And yes, teacher. For example, I remember when I have a ultrasound exam prostate. When the report says impronta in Spanish, impronta, it's 100% is cancer.
Yes.
That's remember. And in her pictures, I don't see that in magic.
Yes, when you get the finding on the ultrasound or CT scan and there is cancer, is difficult, very difficult to explain this, right?
Yes. It's for that I need other labs.
Yes.
Yes, teacher. It's great, but I like that example, case reports.
Yes.
No, that is a case report, teacher. Sorry.
Yes, I'm going to send.
It's the report exam.
No, I mean, We have, well, this weekend we are going to have 2 files again of homework. One file is about the slides homework, of course, exercises for practicing the new vocabulary and expressions. And the second file is the same ultrasound, and you have to write down the explanation that you are giving to Mr. Jones. Okay.
Okay, teacher.
Moreover, in this second file, you are going to explain Mr. Jones his lab results. According to that, you have to give me a general view of the treatment that you are proposing. According to that information that you have to send me writing down, we are going to work on the letter of referral.
Okay, teacher.
That's why it's important to complete this exercise, okay?
Okay, teacher. Sorry, the second file sent in the chat.
No, I'm gonna
Yesterday?
send it at the end of the workshop tonight.
Okay, teacher. Okay. This in tonight send me the file, right?
Yes.
Okay, teacher. I understand. I am understand.
Yes. So don't worry. I know it's very difficult in English to give this information because we have mixed ideas at the moment to talk. So don't worry. This
Yes.
exercise has the objective to practice how to translate, how to exchange our ideas. So don't worry about it.
Yes, teacher. Yes, I am a practice
Yes.
my vocabulary, my ideas, ideas.
Yes, it happens. I'm sure it happens. It's a very common situation.
Yes, teacher.
Yes, so don't worry.
Thanks, teacher. For
Well, thanks for your attendance, for practicing. So don't worry about it. So, Dr. Carlos, see you Monday and have a great weekend, okay? And any question you have about the description, expressions maybe, let me know by a message. That's okay.
Okay, teacher. I read articles. For example, I have the acute injury kidney.
Okay, perfect. That's a great topic. I really love it.
Yes, teacher. And yes, that is my homework in the weekend.
Yes, but if you prefer, I can send you some articles in English. Clinical articles, of course, to your branch.
Yes,
I
teacher.
have lots of them. If you prefer, I can do it. That's okay for me.
If you have many articles, can you send me, teacher?
Yes, I can send them to you one by one. Well, according to the process while reading, you are going to see lots of vocabulary. According to that vocabulary, we can talk a little bit of it. That's okay for me.
Okay, teacher. Thanks for that.
You are now talking about the acute kidney injury, so let me look for something like that. I think I have the last guidelines in English.
Okay, teacher. Yes, I need many vocabularies, the medical vocabulary.
Okay, so let me look for this, and I'm gonna send it to you during the weekend, okay?
Okay, teacher.
Okay, have a great weekend. So, doctor, thank you for your attendance and for the interest. And let's keep on practicing, okay?
Okay, teacher. Thank you for her time.
No, that's okay.
See you tomorrow, teacher.
Okay, see you Monday. Tomorrow is
Ah.
free.
Yes, teacher. See you Monday.
See you Monday. Bye-bye.
Bye, teacher.
Okay, there was Dr. Carlos. At this time, we are with we were with Dr. Carlos, and I was expecting to Grace tomorrow. Grace is now on shift. She told me about that. So let's wait a little bit for her to get into it. She's sending me some message because she's with patients now. And well, we are going to check if at the end it's possible to stay. So I'll be back with my next student as soon as it's possible to get into. And let's have patience. I'll be back with Paula. Bye-bye. Well, I'm still expecting Paula. Let's wait. She's still some time. I'll be back with my next student, no matter who gets into. I'll be back in some minutes. Well, at this point, Paola did not attend. Anyway, now it's the time of Fabiana. Let's expect a little bit. I'll be back as soon as she gets into. Hey, Fabiana. Good evening. Good night. I'm sorry.
Hi, teacher. Good evening. Oh.
Okay. How was your day? Everything okay?
Yes, everything okay. What can I say?
Little baby with me. He's here
Yes.
during the workshop. Okay, Fabiana. I've been checking all the jobs, and well, as I was telling you in the previous workshop, tonight we have on a specific topics, right? I'm gonna show you some studies, and you're going to give me the information as if I were Mr. Jones, Mr. Jones Joseph.
Okay.
Okay. So don't be scared about it. Just talk to me as a patient. Yeah. It's easy to make. We all have the practice on this. Imagine that I'm getting, well, you are in front of an elderly patient and he gives you this picture. And he tells you, hi, Dr. Fabiana, I'm back because of the studies you sent to me. And well, I got the ultrasound now. The doctor who developed this just gave me this picture and told me that you are the one who's gonna explain it to me. I'm scared because he didn't want to give me any detail about it. Can you give me this information, please? In this slide, we are not just recognize the anatomical structures, okay? If it's possible. If it's not, don't worry about it. I understand.
Okay, teacher. Well,
Which kind of a study we are talking about?
sorry?
Which kind of a study we are talking about with this picture?
It looks like a echography.
Yeah, an ultrasound, right?
Yeah.
Yes. Can you realize the structures we are watching now?
So.
Yes, just the ones you are watching. Don't worry about the specific details of positions. I'm not asking for that. Just the structures that are possible to watch at this moment.
Oui.
If it's not possible, don't worry about it. I understand. At the beginning, it's not easy.
Yes.
Okay. Let's go with this. Can you see my pointer? Can you watch it, right?
Yeah.
Here you have the abdominal wall. I mean, the skin, fat tissue, muscles, and the rest of the structures that are in front of. So, the black space is the bladder, full bladder with urine, because you need to get in this situation to check all the structures. This is the prostate. You can see a darker than the rest. The darker one is the tumor. Okay, that's the prostate, all of this structure. In the second view, it is a transversal view. You can complete the measurement and get these values. According to these values, you can get the classification how enlarged is the prostate, right? We all checked this information during the med school. Now it's not the objective to check that information in detail, but according to this picture, well, it's possible to give some information to the patient. for having fun, well, not having fun, for letting the patient to be quiet with this situation because he said he's upset, right? He's
Yes.
worried. When you check the structure in this picture, the borders are clear, there are no satellite images. It doesn't look like with lots of vessels. It could be a benign hyperplasia, right? Just as a
Yeah.
general review. Going ahead. Mr. Jones is scared and he tells you, well, Dr. Fabiana, moreover, the doctor gave me this report. And well, of course, the doctors have awful handwriting. I don't understand lots of words, but the information I read is scaring me because I think it's cancer. Can you explain it to me, please? I'm so scared. I'm worried because I'm grandpa. I want to see my son grow up. Please, can you explain it to me, this information? Can you read this? Is that possible to read this?
Mm,
Hi, Fabian.
yes.
It's possible to read, right?
Yes.
So take 3 minutes for reading this and organizing ideas. And then I am the patient, so explain these medical terms to me in order for me to understand you, okay? Let's make
Okay.
the opposite, okay? I'm here,
Okay,
I'm not
teacher.
leaving, but I'm going to stay without sound because my baby's here with me, okay?
Okay.
Okay, let's organize. If there's any question, ask with all the confidence, I'm gonna answer you.
Okay, teacher.
Okay, Fabian, are you ready now?
Uh, I think I need 1 minute, but teacher, what? I don't understand the word after enlargement, I think.
Here,
Yes, that.
listen, with
Oh,
prostate grade third enlargement with significant median lobe enlargement.
yes, I don't understand too much.
Yes. This abbreviation is the volume of urine that gets into the bladder, approximately 60 ml. Right kidney is normal in size, shape, and ecotexture. Left kidney is normal, but there is I'm not sure about it, there is a polar cyst. Looks like a benign polyp. As a conclusion, greater enlargement of prostate with right renal cyst. Well, it says right, but actually it's left.
Okay.
Okay. So explain it to me. I'm your patient. I'm Mr. Jones. I'm scared. I'm a grandpa. And please, Dr. Fabiana, I'm so worried about it. I think it's cancer. Can you explain it to me, please?
Okay. Well, in the in form of the ultrasound, we can see that we can see that we found enlargement. Well,
I'm sorry, Doc, but I don't understand what enlargement means. Can you explain it to me, please?
okay. We can see that we found a mass that is biggest than the prostate.
So you mean that this mass is bigger than my prostate? I don't understand. I don't realize this detail. I think it's the worst news I got this on this week.